Onc Live Insights is a video editorial program produced by Onc Live.
The core part of our job is sharing information. We order tests, we have to tell patients what the results are. And of course, in our line of work, you have good results and you have bad results. And they're rarely gray, although there's sometimes gray results. So clean scans, those are easy. Clean blood tests, woohoo! It's the negative scans, the negative blood tests that are really important. I'm nervous about the era of patients being able to log in and see their results, because they can see a test result or read a scan result without any interpretation. Classic example would be a patient who reads their CT scan and the radiologist says small nodule, can't rule out metastasis. Well, we see hundreds of those every week in our practice, so we know we can kind of wave at that and say it's probably nothing. Whereas that patient doesn't know that, so they think their cancer has come back or there's something bad there. So it's important to also understand the patient's desire about what they want to know. And again, this is one of those things where we as oncologists can fall into a slippery slope. We can clearly see that news is bad, and we can see the pain on a patient's face. And we're tired and we're busy, and on the one hand, we want to be truthful. We want to show them everything that's out there. On the other hand, we don't want to put out the light bulb of hope. And so this balance between the honest reality that cancer is bad in general, and yours is getting bad, versus there are things out there we can do, we'll keep trying, you're not dead yet kind of push and pull. And we're all bad at this at times, and we're all good at it at times. And a lot has to do with timing, where the patient is, where you are in your day. It's not uncommon that it happens to me. You'll not know that a patient's had a test. You look, you go in, it isn't anywhere in the record, so you don't know whether they had it. And then you go in, you pop in, and you say, well, how are you? And she goes, I don't know, how's my scan? Well, the risk is that you spin around into your EMR and you open the scan up for the first time yourself and read it, and if it's bad news, boy, that's a tough moment, because you didn't know about the test and now it's bad. So usually in that setting, I say, let me go find it. I get out of the room and go look at the test. If it's good, I'm popping right back in. If it's bad, then I come in a different demeanor. I come in prepared myself. I know I'm not getting out of there fast. So, if I'm busy in my clinic, I might clean up another patient that's quick before I go back in there, because I know I got to sit and go through this with them. So as much as it all happens to all of us, we get caught not knowing, didn't see. So regain control over that environment, adopt the proper demeanor, carve out the proper amount of time, and then go back with the patient. Patients want different levels of information. I've got some patients who keep spreadsheets of their tumors or their blood tests or whatever it is. And I've got others that don't ever want, they just want to know yes or no. Is it better? Am I okay or not? Right? So, and that's fine. Both are fine. And they're both, if you will, compensation tools for our difficult situations. So we get that. So everybody's different. You have rights as a patient to your information. I've got some patients who want to see their scans. We can pull them up on the computer nowadays, it's easy, and show them their CT scans. I've got other patients that never want to look at it. I encourage them to know more. I like my patients to know the facts, to know the details, to share them with me, because honestly, it makes my job easier. I can ask a patient, as an old doctor, I can go in and ask a patient, what are we doing to you now? And they're forgiving of me. They're like, you know what we're doing. We're doing that. Oh yeah. And so if you have that level that they know, and when was your last scan? They know. And I like that level of interaction. There are others that want to be in control and know everything and all, but that's the different strokes for different folks.